dear students and esteemed learners, welcome back. Welcome to the last week of our course on sociology of health. And this week, we are discussing the issues related to health inequality and sociology of health. And in the previous lectures, we have tried to understand the issues related to health inequality, and then we also tried to understand the issues related to health information. And health information is very instrumental in identifying inequalities. And here we have lecture number 59, and the topic that I've selected for today's lecture is non-government organizations, generally known as NGOs, people's participation, and healthcare in India. So this is going to be a very interesting lecture again, because we'll talk about the non-government organizations, NGOs, and I think all of us are aware of some or the other NGOs, the national level as well as the local level. And the topic that I have covered in this lecture are understanding NGOs, then how World Health Organization is looking towards NGOs in terms of community participation, then Millennium Development Goals and its role in promoting the role of NGOs, and then NGOs in India and the NGOs which are related with the healthcare job, and overall role of NGO in healthcare in Indian context. So these are the subtopics. Some of these could appear overlapping, but we will try to understand. And yes, again, this is again a very big topic. We will not be in a position to talk everything that needs to be talked, but we will try to cover the main points so that we get an elementary level understanding about the topics that we have identified. So let us go to the first slide, and we will begin with trying to develop some elementary understanding about NGOs. So a non-government organization is a group that functions independently of any government with the objective of improving social conditions related to multiple aspects of life. So there are 2-3 points that I have highlighted here. One is it is functioning independent of any government, and that is why the term non-government organization is there. We will try to understand the basic difference between the government organization and non-government, and then only we can understand the non-government. So the government organizations basically operate under certain legal framework, under certain laws. These are basically followed by a bureaucratic structure, and then there are protocol related to almost each and every aspect. So the government organizations are generally considered as rigid, and they are bound by rules and regulations. So every officer who has to take a decision within the government system has to follow certain rules, regulations, and protocol. They don't have that kind of the liberty of doing things taking into consideration the need and the requirement of the situation. They don't have that kind of flexibility basically. So the non-government organizations are different from government because they are more flexible. They are not having that kind of rigid rules or regulation or protocol on certain issues. Yes, of course, for the organizational issues, they have to follow those rules and regulations. And one more thing, NGOs also get guided by the government rules, right? But there is a difference. Getting guided by certain rules is one issue, and then following the government rules in each and every step in the day-to-day functioning, is another issue, right? So when we are saying that non-government organizations are uh, flexible in their approach, in the sense that for their day-to-day performance they don't need to follow the rules which are followed generally at the level of the government organizations. So that way they have more flexibility. But of course, we should not say that these are not guided by rules. Yes, of course, every NGO is basically guided by certain rules which are uh, prepared by or which are implemented by the nation state where that NGO is operating. So this is one important aspect related to this. Then they are actually functioning to make improvement in the social conditions related to multiple aspects of life. So we should not say that these are operating only for the social issues, because very often the NGOs are operating for economic issues also. There are a good number of cooperatives which are operating like NGOs, right? So the NGOs can cater to or take care of some of the financial needs of the people also, and may operate in the form of some kind of cooperative also. But they are identified as NGO to the extent that they are not getting directly governed by government, and they are not having the kind of rules and regulations which are followed within the bureaucratic structure or the government structure. So that way, then the most important feature or requirement of an NGO, and that is they are not profit organizations or non-profit organizations, because NGOs don't work for making profit. They work for achieving certain social goals which are based on certain values, right? So if a particular organization is working for making profit, then it will not be considered or identified as an NGO, because primarily, basically, these are non-profit or not for profit organizations. And then these are based on voluntary membership also, right? So not for profit, when we say, then how do we differentiate these from the rest of the organizations? So basically we talked about the government organization, and those are also uh, different from the NGOs. But there are private organizations which are for profit organization, for example the corporates or any private business. So these private businesses operate for making profit. So NGOs are different from the private organizations or corporations, to the extent that those private organizations or corporations are working for making profit, but NGOs are not working for profit. So the commitment to the social values is the core defining aspect of NGOs. And so these are actually based on voluntary membership, because not every individual is having the kind of willingness or the kind of affordability to work for not for profit organizations, right? So this is how we can understand the functioning of the NGO, or we can define the NGO. Then NGOs are also identified as civil society organizations or voluntary organizations, because these are actually established at the level of the community or at the level of the nation, or even at the level of the international fraternity. Why do we call these civil society organizations also? Because they engage people, and that way they are different from the government. So if there is an issue in any society where there is a gap between the government and the people, then basically people may organize themselves, and that may become a civil society organization. And when that is basically getting a little more structured, then it may become an NGO also, depending upon the situation. But that way, an NGO is also identified as a civil society organization. And sometimes the word voluntary organization is also used, because that is based on the voluntary membership of people. NGOs focus on a wide range of issues and areas. There can be any number of issues. Anything that is related to our social life or cultural life or even political life or economic life basically may become an issue or an objective for the operation of an NGO. It's not identified on the basis of the kind of objective that it is having. It is identified on the basis of the kind of protocol that it is following, the kind of intention that it is having, right? So if it is not working for profit of its own, then it will come under this category of NGO. However, if it is working for enhancing the economic status of certain vulnerable group or disadvantaged group, then it can have some kind of uh, economic aspirations of those people also getting reflected in that. But there is a difference. The difference is who are the members of that NGO and who are the beneficiary of that NGO. So NGO can earn some profit for the beneficiary as such, but not for the members who are working in that NGO. So that way we can understand the NGOs and its boundaries. And then World Bank has also talked about NGOs in some of the uh, background papers. NGO have been discussed in World Bank documents, and World Bank is also basically operating with good number of NGOs. So they have also developed their own operational definition, and they identify NGOs as private organizations. I have added the word without profit because that is very important, that pursue activities to relieve suffering, promote the interest of the poor, protect the environment, provide basic social services, or undertake community development. Community development is basically a very important goal, and in some way or the other, almost all the NGOs are linked to this goal of community development. Then, in one World Bank document, again, the comparative advantages of NGOs are identified. And according to that document, uh, the capacity to reach poor communities and remote areas with little infrastructure and minimum resource, that is one of the comparative advantage of the NGO. This advantage they have over the government organization or any other organization. And then, where government services are usually extremely limited and ineffective, the NGOs can have access to those areas and extend the services. Then, the capacity to promote local participation and community empowerment. NGOs primarily are working with people, and so there is more scope and opportunity to have people's participation and connect with the people. Then they basically operate on low cost, and they also have the kind of flexibility to make certain innovations and adaptations. So what we can understand from this much discussion, that NGOs have some kind of functional independence, and so they have the flexibility in their approach. Then they can reach to those areas also where the government machinery is either unable to reach, or it may become very costly for the government machinery to go and settle or provide the services over there. And then one more thing, the government can have certain organization for a specific purpose, but once the purpose is served, then the organization cannot switch over overnight, because government has its own protocol, right? But on the other hand, if an NGO is engaged for the work, then the NGO can move once the purpose is fulfilled, right? So that kind of flexibility is very much visible. NGOs recognize the importance of community engagement in achieving sustainable outcome. They work closely with the local communities, involving them in decision making processes and empowering them to take charge of their health. NGOs train community health workers, equip them with essential skills, and encourage them to become agent of change within their communities. So the NGOs can perform multiple work, and one of the specific area of interest of the NGOs is health also, right? So they can work in for the economic advancement, they can work for democratization, they can work for empowerment of people, and they can also work for making the health services accessible to people. NGOs rely on a variety of funding sources. Now, you may have this question that if NGOs are performing all this work, then what is the source of funding for the NGOs, right? So they get funds from the government. That is one very important source, and then they can also get fund from the private individuals or the private sector or the philanthropic organizations, or they can sell the kind of goods and services that they have basically produced. It applies to certain NGOs which are operating in the economic sphere, and then sometimes they are also allowed to take or collect funds from the foreign countries or agencies, right? So there are multiple ways through which NGOs can get fund, but in Indian context, a good number of NGOs get funds from the government itself. Then we need to talk about World Health Organization and its focus on community participation, and then the role of NGOs. So, World Health Organization's Alma Ata Declaration of 1978 talked about primary health care and emphasized the need of community participation. Now, it focused on achieving the goal of health for all through primary health care. Now, the entire idea of primary health care is based on the idea of and the practice of community participation. And so, for making the goal of health for all effective, the World Health Organization basically suggested the nation states to have this community approach. And so, the NGOs and civil society organizations became very important because these were very helpful and instrumental for the nation states to reach to people. So that way, the Alma Ata Declaration of 1978 became very instrumental in the promotion of the functionings of the non-government organizations at a global level. Then WHO in a discussion paper basically talks about the functionings of the NGOs, and it actually highlights the importance and significance of the NGOs. Uh, it explains that in many cases, civil society organizations provide cover to group otherwise disadvantaged in health services access, or assist government in major treatment campaign and disease control program, in drug distribution, in reaching vulnerable communities, and in fostering innovative approaches to disease control. That means World Health Organization is also acknowledging and appreciating the contribution of the NGOs in various domains related to healthcare. And then the NGOs can contribute in multiple ways, like they can provide services in response to community needs and adapted to local conditions. They lobby for equity and pro poor health policies. That is very important because if we see the process of making of the legislation or the laws, then very often we see the presence of certain advocacy groups. Now, these advocacy groups are the NGOs basically, who have a kind of commitment for promoting those ideals or those ideas or those values, and for that they need the kind of legislation, and so they are very instrumental in the acceptance of those ideas at the level of the policy making. Now, one very obvious question or natural question that is coming to mind is World Health Organization an NGO? No, I was trying to find the answer of this question, and the website of World Health Organization itself is answering that question. And I have quoted this para from the website of World Health Organization itself, and I have placed the link also. WHO is an international organization composed of a group of member states, and so it is not an NGO. So, WHO is not an NGO, and it is mentioned in the website of World Health Organization itself, because it has to work with the member states, and the member states basically represent the governments. So, that way it is working in association with the governments, and so it is directly connected with that, and that way it is not an NGO. Now, as we talked about the Alma Ata Declaration, similarly, the Millennium Development Goals and the Millennium Declaration also talked about the role of NGOs. Now, something very important was also happening at that point of time, at the time of the Millennium Declaration. In the 1990s, basically, we witnessed globalization, liberalization, and privatization. So, with that extra force of privatization or extra focus on privatization and globalization, the, the governments basically narrowed the areas of operation, and the NGOs somehow created some kind of departure from provider of services, and they become basically the regulator of the services, because the private players came as the major provider of the services. So, in that situation, when the government is somehow narrowing its efforts or its areas of interest, then those areas could not be left open only for the private sector, because some of those areas were not having a scope of profit making, or those were very sensitive also. So, in those areas, the government want some NGOs to operate so that they can work as per the suggestions of the government, right? So, because of that very thing, out of the 8 Millennium Development Goals, almost every goal required some kind of support from the functioning of the NGOs, not only in India but world over, right? So, that way, the MDGs, because of the simultaneously ongoing processes of privatization and globalization, these actually created a space for the functioning of the non-government organization, because these NGOs were very helpful or instrumental for the government to serve the kind of things that the governments wanted to serve, whether that was related to education or poverty reduction or healthcare provisions. All these things were happening simultaneously. Then, if we talk about the role of NGOs in Indian context, then we can see that there are important developments in post-independence India. In the 1950s, basically, India adopted the community development approach, and people's participation was considered very important, and that was also considered very important for enhancement of the democratic values, right? So, for enhancing the community development approach, or people's participation, gradually the NGOs were encouraged to operate, so that some platforms should exist where people can have direct sort of engagement, and which could be mobilized whenever there is a need of some kind of empowerment of the community or strengthening of the community under the community development program. So that way we can say that in the 1950s itself, there was the beginning of the process of engaging the NGOs in the for the issues related to social mobilization or social development at a larger level. And then for these functions, the governments also provided funds to those NGOs. And in the 1960s and 70s, we also see that there were certain benefits related to income tax deduction for the donors. So this also encouraged the private corporations, private individuals to come forward and participate in the goals that the NGOs are having, because primarily they are focusing on certain social values and providing services to the needful. So this is how the things were operating. Then Fernandez argues that in 1970s and 80s, many government programs were the catalyst for village-based groups around issues of health, education, drinking water, forestry, women development, etc. Like voluntary organizations promoted the Mahila Mandals or youth groups or the farmer groups, etc. And this way, not only the community development organizations, but organizations related to the specific interest group also came into existence, right? So the growth of the non-government organizations continued in the decades of 70s and 80s. Then in 1980s, basically, we see that something important happened, in the sense that we had the first national health policy 1983, and it was guided by the Alma Ata Declaration of 1978. So it talked about engaging people and engaging the non-government organizations or the voluntary organizations. And then in the National Health Policy of 2002 also, it talked about having some kind of collaboration with the non-government organizations, because the goals which were identified could not have been achieved without the support. For example, immunization. Now, that basically covers a huge population, and the government machinery is always limited, and especially the healthcare professionals or staff are always limited. So, the kind of massive program which is required for immunization kind of thing will not be possible without taking support from the non-government organization. I remember my childhood days when the the 2 drops for life pulse polio program was being conducted, and then the government was taking support from good number of non-government organizations, and of course with also other type of organizations, right? So that way. And then we often see that good number of blood donation camps are being organized, or some kind of awareness camp is basically organized. Or in 1980s, when there was onslaught of HIV AIDS, then good awareness camps were basically created. So that way, the government is often taking the services of the NGOs to fill the gap of a lack of manpower also. And then sometimes the NGOs are having the expertise that the government is not having. So that way also the NGOs are very instrumental in extending the or providing the healthcare services to people at large. And then one important point, the Christian Medical College Hospital basically emerged in Tamil Nadu, and it was primarily based on the non-profit orientation. So there are good number of institutions which come into existence and which provide wonderful services to people, and basically they operate as an NGO or a non-government organization, in the sense that these are not meant for profit making. However, the colleges do follow the rules and regulations of the government in most of the affairs, but basically we are talking about the not for profit orientation kind of thing. And then during COVID we have seen that how civil society organizations and good number of NGOs basically they came forward and served people. Then we also see that when there is a nutritional deficiency among people, or then there is some kind of other problems like the disease control programs also, then also some kind of support from the non-government organizations are visible. So we can conclude this lecture by identifying few important points. The role of NGOs in healthcare in India is actually multifaceted, multi-layered, and multidimensional. They often help by making advocacy for specific policies. Then they often help through donations and perform the philanthropy work. Then often in care for children, women, persons with disability, elderly, palliative care, all these issues basically engage huge manpower and human care. So the government machinery is literally finding itself very limited in terms of resources when there is an issue related to care by human beings is required, right? So the NGOs do have the advantage because these are based on voluntary kind of work, and so people can join these organizations and serve the humanity. So these are some of the important issues I wanted to talk. And before we close, I would like to say that with the increasing challenges in the domain of health and the shrinking size and functioning of the governments, basically in the age of privatization and globalization, the role of NGOs are very important. uh, they have to perform good number of things. They are already performing good number of things, and the active role of NGOs is also considered good for the empowerment of the disadvantaged section, and for good for the beneficiaries of good number of government programs, and uh, last but not the least, for the functioning and effective functioning of the democratic society. So this is all about the role of NGOs in healthcare in Indian context. And I hope you found this lecture relevant. And if you want to know more about this, then I have added here few references and readings. You can go through these readings and references, and then try to observe the functioning of some of the NGOs which are available in your area also. So take care. We will meet in the next class.